Good evening, everybody. My name is Derek Griffin, and I'm a chartered physiotherapist in the Secours Hospital in Tralee. The topic of this year's National Arthritis Week is Every Movement Matters, and in this brief presentation, I'd like to give you an insight into the important role that exercise plays in the management of people with arthritis. As part of a self-management strategy, exercise is recommended across the international guidelines for people with arthritis. This recommendation is both for people with inflammatory arthritis, such as rheumatoid or psoriatic arthritis, and also for people with osteoarthritis, so the common types being knee and hip osteoarthritis. We know that the benefits of exercise for people with arthritis extend much beyond pain and can help improve things like function, it can control inflammation, and enhance overall quality of life. However, we also know that fear can be a big barrier to getting people more active. For example, we know that almost 2/3 of people that have been diagnosed with rheumatoid arthritis are fearful of exacerbating their pain or making their condition worse, which can be linked to things like more anxiety and lower levels of activity in the long term. There are also some unhelpful beliefs related to arthritis, including the belief that exercise will harm the joint or that pain is a sign of damage. However, we now know that exercise progressed gradually in a sensible manner is not harmful to the joint and can improve function in the long term. So for example, a low level of activity or exercise can result in reduced muscle strength, reduced or poorer bone health, and higher levels of pain in the long term. And exercise is a really good way of combating this. We also know that pain is influenced by many aspects of your life and your lifestyle. And an interesting fact that some people might not be aware of is that more advanced arthritis on an X-ray or an MRI scan, for example, does not necessarily mean that you'll have more pain than somebody with less advanced changes on an X-ray or an MRI scan. And I'll talk about this point again towards the end of this brief presentation. So I like the quote that I've included in this slide, that you don't have to believe everything you think. And some of these beliefs in the general population can sometimes be unhelpful and in the long term lead to lower levels of activity. So some very practical tips in terms of including exercise as part of a management program for people with arthritis. So firstly, you should increase your level of exercise in a very gradual manner. So we know that a little goes a long way, and this has to be progressed very gradually. Importantly, there is no lower level or threshold of which people can benefit. A little goes a long way. And this is especially true if your activity levels have been very low for a long period of time, or if you have other health conditions that limit the amount of exercise that you can do. And I would suggest that you decide on a plan together with your healthcare team, which will usually involve your GP, your rheumatologist, and your physiotherapist. There is evidence that different types of exercise are effective for people with arthritis, and this includes things like aerobic exercise, like walking, cycling, swimming, and running, and strength training. The choice of exercise should depend on your individual situation and your lifestyle. And this is the conversation that you need to have with your healthcare provider. So you must consider what is realistic, what is feasible, and what you enjoy and motivates you to do. There is no one exercise that is superior than another form for people with arthritis. And this allows people to choose from a wide array of activities or exercises, depending on their individual motivations. We know that pain during exercise or activity is not uncommon, but pain should be tolerable at all times. And any pain in the 24 to 48 hours after doing an exercise or an activity should not significantly impact on your function. So it shouldn't impair your ability to work, sleep, or impact on your home life. If pain increases to a level which it does impact on your function, then your exercise program needs to be adjusted, and you should discuss this with your healthcare provider. Provided that any pain increase is tolerable and doesn't impact on your function, this is usually okay. And importantly, that over time, so from day to day or from week to week, the pain shouldn't be increasing. this is another sign that exercise may need to be adjusted, and you should have this discussion with your healthcare provider. An important point with exercise is that your exercise levels are consistent and very gradually progressed over time. So the consistency is possibly more important than the amount of activity that you do and the intensity that you do it. And the benefits that come with exercise, especially in relation to pain and function, can often take a considerable amount of time to become apparent. So this is important for people to understand, because if the expectation is that pain and function will change very quickly, people can lose interest and lose motivation and stop an exercise program. Whereas sometimes, and more often than not, you need to persist with the activity or exercise for many weeks and often many months to see the optimal benefit. So most people with arthritis, both osteoarthritis and inflammatory arthritis, will have experience of dealing with flare-ups. And flare-ups are not uncommon and are to be expected as part of any exercise plan going forward. So it's important that when a flare-up happens, that people have the resources available and know what to do to deal with a flare-up. So the first thing is to consider flare-ups as a learning opportunity rather than as a setback. And you can reflect on the situation and what you can learn from it. So what factors might have contributed to this flare-up and what can I do differently going forward to change that? When pain increases to a level that it impacts on your function during a flare-up, you may need to modify your activities in the short term. And that's absolutely okay. So as part of any exercise program, sometimes you may need to pull back on the exercise program in the short term to allow symptoms to settle. Flare-ups can be a source of stress, and it's very important that we manage that stress response well. So we should consider focusing on healthy sleep habits during this time. Look at strategies like mindfulness and meditation to control that stress response. Use things like music as a form of distraction and as a way to enhance our mood. And focus on tasks that we enjoy or are of meaning to us. And again, this is to reduce the impact of the flare-up on our general well-being. It's also important when flare-ups happen that we stick to the plan and ultimately think about what is the end goal, and to focus on that goal, and to see the flare-up as just to see the flare-up as a slight detour rather than meaning that the end goal isn't possible. Finally, and I alluded to this earlier in the presentation, it's really important that we think big picture, and that pain at any one time or for any individual is not just about what we see on an X-ray or on an MRI scan. It's much more than that. And for example, we know that pain is influenced by many aspects of your life, and this includes things like stressful life events. So during times of stress, and most people are experiencing stress over the last few weeks given the current COVID-19 situation, and it's important during these times that we have appropriate skills to manage that stress. Our general health will usually impact on how much pain we feel. So if you have other healthcare problems, it's important that they're managed really well, and this will have a positive effect on pain in general. This presentation has been around the importance of exercise and physical activity, and we know that progressed gradually over time, that people that do more exercise or engaged in more activity can reduce their levels of pain. It's important that we rely on our social support and that we interact in our community and in our own social settings. And social support is an important mechanism by which we can reduce pain. In times like this, when it's difficult for people to meet up, we can use social media as a way of maintaining social contacts and social support. Sleep plays an important role in our general health and well-being, and we know that lack of sleep or poor sleep quality is a risk factor for developing pain in general, and not just in relation to arthritis, in relation to a number of pain conditions. So anything that can help improve your sleep or your sleep habits or your sleep quality can be an important part of a management plan for people with arthritis in conjunction with an exercise plan. And it also ensures that we get sufficient recovery from an exercise program to allow for optimal adaptations. We need to take control of our mental well-being and realize that low mood, depression, anxiety all link with pain and can exacerbate pain, and vice versa. So an increase in pain can have an impact on how we feel and on our mood. So looking at ways of enhancing our mental health is important also. How we cope with pain is also important, and we've previously mentioned the importance of how to cope when you have a flare-up, and to look at more active ways of coping around pain. So use things like exercise, meditation, stress management skills, rather than simply relying on things like medications and injections. And finally, our beliefs and expectations have an important role to play. So if we see our condition in a very negative way, this can have an impact on our mood and how we approach our condition, and in the long term can lead to more inactivity and avoidance. So we need to see arthritis as a condition that we can help by making simple lifestyle choices, or changing lifestyle choices, especially promoting things like exercise, sleep, nutrition, and our general well-being. And I like this graph on the right of this slide. So it's not one behavior, and we don't have to change everything in the one go, that we can make small changes to each of these areas and set goals in each of these areas over longer periods of time. And all of these changes together over time can add up to big changes. So it's important that we realize that we can't change everything overnight, and any changes that we do make need to be gradual, and we should prioritize areas in our life that might need to change, or that we can change, and focus on those things initially, and over time change other aspects of our lifestyle and that might help to improve our overall well-being and health. So I hope that presentation gives you a little insight into the importance of exercise and movement in general for people with arthritis and other pain conditions. So it's very important that people do realize that every movement does matter, and the amount of exercise is less important than how consistent we are with exercise. And remember that a little goes a long way. So my contact details are on this presentation here. So please feel free to